You're always going to get bad news. It's going to come. Sooner or later, you're going to get it. And you might not have any need or reason to see a doctor for decades. And one day, you're gonna have something. If you live long enough, it's gonna happen. And it just comes down to, what are you gonna do? How are you gonna handle it? I've been in fitness my entire life. Started in the early 70s as a young lad. Around 1975, I won a silver medal in the Junior Olympics for weightlifting, and competed on and off for 50 years. My name is Johnny Olson, and I own a gym in Boca Raton, Florida, called Johnny O's Gymnasium.
Make it happen. This is what we do here at Johnny O's.
Come and see why the pros train here.
My success is based on my members' success. In the big gyms, you're a number, and you're a monthly payment to them. They don't care if you succeed or you fail or you never use the gym. And we're completely the opposite of that. That's why boutique gyms like mine are the places that you really want to go to if you're looking to get results. I built it for specific people, basically athletes and people that want to make a difference in their life fitness-wise. And I set out with a goal and what I wanted to build specifically, and I accomplished it. And I did it in about 45 days. So that's kind of what I like about it the most. I eat healthy. I work out every day, swimming by 4:35 a.m., 7 days a week. And after that, I go into the gym and I work out myself. I come home, I have breakfast, which is always a healthy meal. And I go back to the gym and I help people achieve the goals that they're looking to get.
Champion Kansas City Chiefs, Travis Kelce.
Yes, I'm a healthy guy, and in being in fitness all these years, you live that lifestyle, you preach that lifestyle. You know, we hear it every day, and most of the times we all think, well, it happens to other people, it doesn't happen to us. But if you're realistic about everything in life, you know that it could happen to you. I get my labs done, my blood work done, 4 to 6 times a year. But the way I found out was a simple lab test. And my PSA came back high. The doctor called and said, you really need to see a urologist and have a look at this, because the PSI went up 2 points in under a year. And that was a warning sign. And I went to the doctor, and initially they did a biopsy with me. And that first time I did the biopsy, it came back negative, but my PSA kept rising from future lab results. And eventually I had to go in and get another biopsy, and it came back that I had prostate cancer. I took the doctor's call, and he told me, and you know, it's a little startling at first, and I went for a drive, and I was listening to some music. I didn't know what I wanted to do. I just kind of wanted to be alone, and eventually my thoughts went to, well, you know, what makes you feel best? And going to the gym feels best for me. And I literally went to the gym and did a workout. Really, my mind was focused on what was going on, but I kept pushing myself and working really hard. because of the news that I had just got. And eventually when I went home, my girlfriend at the time was now my wife. She was waiting, and I told her, and you know, it was a little difficult, but it's life. Unfortunately, over the last, now I'd say 10 years, I have had 8 surgeries, and not all from the cancer, but a couple of them were. And when you have a lot of surgeries the way I do, what I do is, and I suggest this to everybody, when you go see a doctor about possibly having surgery, there's a lot of questions that you want to ask them. But there's 2 questions I always strongly suggest. Number 1, how many of these surgeries have you done? And number 2, God forbid this happened to you, who would you go to?
I am a graduate of Yale University's School of Medicine. I did my residency in Houston, Texas at the Baylor College of Medicine, and did my fellowship at the University of California, Los Angeles.
I kept hearing over and over, go see Dr. Angelo Gousse, and that's exactly what I did.
When I met Johnny, I felt like he was a very pleasant, active gentleman. He certainly had an active life, and he was very depressed in a way. He was very low on the fact that he had some issues related to his prostate cancer treatment.
He happened to be the professor for my cancer surgery, the one that took out my prostate, and so he was his student, and I got a chance. You know, I knew that this guy was one of the top surgeons that took out my prostate, and for him to have Dr. Gousse as his professor really meant a lot to me, and that pretty much sealed it. And I said, let's do it. The fact that I'm still here, and after my surgery, they sent the prostate out to a lab to test it, and it came back that I was stage 3 cancer, and had I waited even 6 months longer, it may have broken through the prostate, which then would have spread throughout my body, and I wouldn't be here today. I wouldn't be sitting here doing this interview.
When I met Johnny, he presented with significant urinary leakage.
One of the side effects is incontinence, and I had it, and I was trying to work around it for probably 2 or 3 years, and it wasn't going away.
That was an issue for him. Particularly, he had explained to me that he did own a gym, that he liked to lift weights. So here you are, you have a patient who's very active physically, who's essentially a bodybuilder, and I can even say a professional bodybuilder, and now he has to worry about, leaking urine each time he works out. So that decreases his willingness not only to stay in shape as an individual, but to really become a great coach for the gym that he actually owns. The greater the degree of incontinence, the higher the rate of depression, and the more severe it is. Some patients have committed suicide because of urinary incontinence. So it's one of those problems, if you have it, that can push some patients to commit suicide if there's no cure.
Not fun, but there is ways around it.
Many men don't realize there's a cure for this problem. I recently treated a patient who was incontinent after prostate cancer treatment for 20 years.
I was actually in Dr. Gousse's office one time doing a follow-up. Came in the office and he said, would you mind speaking to this man? And he's here with his wife. And he's still hesitant about doing the surgery. I said, send him in. And a minute later, his wife walked in without him because he had to go to his car out front to get another diaper. He didn't want to do it. He was hesitant. And, you know, it's like, dude, forget it. Stop worrying about this. Get it done and start living normally. Basically, they put a clamp on the urethra tube, and there's a device that's put inside you, and there's a button in the scrotum, and when you need to urinate, you hold the button, it releases the clamp and allows you to urinate. And you go on and you live your life. So it's certainly better than the alternative. Best part is, I don't have to think about going out somewhere. What color pants am I gonna wear? Am I gonna have
What
an
about
accident?
sexual health?
No.
Like intimacy, stuff like that. I know that's a big issue after prostate cancer.
Yeah. There's a lot that goes on with that. And what happens is the prostate is surrounded by what they call a bundle of nerves, and those nerves can, when they get affected, can have a major impact on your being able to get an erection or not. The other major side effects is ED, erectile dysfunction.
The erection problem, often the rigidity of the penis is altered. And the reason is because the nerves which allow the blood vessels to dilate and function properly are injured, either during the surgery or by the radiation. And this is the rigidity. So because of that, it's almost impossible to penetrate. And many, many times, this degree of erectile dysfunction is not responsive to medications. You know, the Cialis, the Viagra. Oh, the patients don't respond to these type of medications. The most natural erection you can have after prostate cancer treatment is called the inflatable penile prosthesis, meaning it's a device that inflates and it gives you the great rigidity, and then you can press a button and then it deflates. The inflatable penile prosthesis, in many cases of refractory cases of erectile dysfunction, is a lifesaver, is a game changer. And this is exactly what happened to this patient.
Around 1985, Johns Hopkins did a survey. It was a telephone survey done by some women in offices calling 500 former prostate cancer patients. 85% of the people said they were fine, they had no issues. And this was now 10 years ago. So it was, 2014. Today, we have that same test and survey done, and it's around 43% of the people say that's where they have no issues. Do you know why in 1985 there was 85% of the people were fine, said they were fine? Because they lied. Men would be on a phone with women, typically an intern that would be calling to get answers to the survey that they were doing, and 85% of them said they were fine, and they weren't fine. And back in 1985, they did not do the robotic surgery. It was done by hand. Back then, there would be a much greater number than the 42% that we have today, much greater. But yet 85% of them said that. So it goes back to men have egos. They don't want to lie about something that's humiliating and depressing, and they don't want to share that. There's no good cancer. Prostate cancer is certainly not a good cancer either. And it's men's version of breast cancer. But the big difference between breast cancer and prostate cancer is the awareness. If you go onto Instagram and you look at breast cancer awareness, there'll be 15, 18 million followers. And if you do the same for prostate cancer, it's in the tens of thousands. It's nothing. And a lot of the reason behind that is that men have egos. We don't like to talk about things. This cancer has some side effects that are humiliating and depressing. And men just don't want to talk about those things.
It's okay to be treated for prostate cancer.
Yeah, it sucks.
But the good news is there is a cure, there is a solution for any side effects from prostate cancer treatment.
You can't get an erection in a coffin, guys. There's so many men that experience this, and since my diagnosis and my surgery, I have literally taken on the thing of experiencing. Let people know what to expect. Let them know that it's not a death sentence if you can catch it early. Let them know that the side effects, although humiliating and depressing, doesn't end your life. You know, I've been cancer-free now for 10 years. 10 years last June.
The male ego, I think, yes, I don't have a problem. I don't want to admit I have a problem. I think that exists. I see it sometimes, but I could tell you that most of the time, by the time they make it into my office, that ego has been trimmed quite a bit by perhaps previous conversations with a spouse, previous conversation with a partner, or patient work that through. They're like, it's either I eat my ego or I'm gonna be living the rest of my life in urine, because years have passed. I'm still in diapers. I still have to deal with diaper rash. I still have to smell like urine. And I found out that by the time they come to see me, they're receptive.
Do what's right for you. Do what's right for your family and your loved ones.
It's very gratifying to a physician, to a surgeon, to be able to change, to be able to improve the quality of life of the patient. And for me, the greatest satisfaction is the smile I see in their face, is the story they tell me about how their life has changed in a positive manner and the things they are enjoying now that they didn't used to enjoy before. And for me, I go home with a smile on my face, knowing that I made a difference in that patient's quality of life.
I have welcomed 4 grandchildren into the world, and I probably wouldn't be here if I didn't go ahead and do the surgery initially to pull and have my prostate removed.
It's a great thing I'm able to offer to society, to our community, and I think that you're absolutely right. I feel elated and very, 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 very blessed to have been given the opportunity to change somebody's quality of life in a positive manner.
I'm grateful to be alive.